By focusing on child's needs, Janov implicitly made his theory a humanistic, that is, belonging to the third humanistic school in psychology. The same applies to his view that human organism has the ability to repair itself, to cure itself, to heal itself, under certain conditions. Carl Rogers, also an American psychologist, a founder of humanistic school in psychology, wrote about organismic self, the true self, and the habitual self-concept, adding an ideal self to it. Janov made it very simple. There is the real self and the unreal self. Real self is what you really are if your needs are satisfied, and unreal self is a complex physiological structure you developed to protect yourself from the pain of unfulfilled needs. Rogers proclaimed his three basic psychological conditions that must be provided by the therapist so that the client can develop as a healthy person. Janov offered his primal therapy as a treatment and a condition under which a neurotic person can get rid of his unreal self and connect to his real self. In the beginning, in the primal scream, Janov used some rather unconventional and forceful techniques to break his patient's defenses, put him or her in touch with his or her pain, and produce a relatively quick cure in a 6 to 8 months' time. Experience showed him that cure takes more time. Patients first learn how to primal properly and not abreacting within a formal therapy time during a year or two, and then continue to primal on their own with little help from buddies, other primal therapy patients, or by coming back to the center for more sessions, or by taking part in follow-ups. When, after a painful period of learning, you finally have a primal or real feeling, it is unmistakable. You finally feel painful feelings that have been waiting maybe for years to be felt. You are doing now exactly what you would have done then as a child, should you have had a feeling person, ideally a parent, who was interested in how you felt after something happened and invited you to feel these painful feelings. The experience of primal is always an optimal mix of pain and joy. When we say joy, we mean feeling of liberation and resolution. You cry because you didn't have something. This is a lack. You lost something, loss, or you must accept something painful, but you feel pleasure at the same time because you finally connected to your real need, to a part of your real self. You accepted your truth. You resolved a huge tension inside yourself. What complicates the whole process is the abreaction, a phenomenon similar to primal or real feeling resolution, but not really the real feeling. We all occasionally see someone crying in a way that doesn't feel healthy or resolving. It feels phony, forced, inauthentic, and some call it crocodile tears, theatrical, pathetical, hysterical. Children's instrumental crying is often distrusted because they use crying as an instrument to get something from parents. So, as in the case with so many things, a knife, money, power, IT skills, arms, also crying can be used in a good way and it can be used in a bad way. Used and misused. Both the therapist and the client must pay attention to what feeling they are eliciting. Is the client ready for it? Is the client supported internally and externally to feel the feeling? Is the feeling not a mixture of two or more different feelings? Is the feeling not mixed with developmentally earlier feelings from babyhood and so on? Properly resolved feeling is a very moving experience both for the client and for the therapist, an external observer. It can last from a few minutes to a few hours. The client feels a tremendous relief, resolution of tension during it and after it. If vital physiological functions are measured, there is a parallel drop of pulse, blood pressure, breathing cycles, and so on. Spontaneous insights occur during a few days after the session, and positive changes in thoughts and behavior are obvious and involuntary. Primal therapy and good deep feeling therapies are unrecognized by a broader psychotherapeutic and psychological community, unfortunately, because they have so many things to offer to a traditional psychotherapy. Thank you.